right, so this is the last section here of 11.3. We're going to be looking at kidney disease. So the first application statement here is that blood cells, glucose, proteins, and drugs are detected in urinary analysis tests. So what does that mean? So when your urine is tested, it can tell many different things about the person. So for example, if you're suffering from kidney disease, this is a condition where your kidneys aren't working properly and your kidneys is not able to filter your blood properly. So if someone has kidney disease, that's going to be expressed through these tests via a number called a glomerular filtration rate, GFR. If the kidney continues to be diseased and this is prolonged for a long period of time, many years, this can lead to kidney failure, which is life-threatening. So we're going to talk about the GFR number and what that means in just a moment. So let's look at urinary analysis. So we know that your blood, right, gets filtered in the glomerulus. So that means that in this ultrafiltration process here, that happens right here in the glomerulus in the Bowman's capsule, as the blood gets filtered, you should be keeping important proteins and blood cells in your blood, right? They shouldn't go past your blood into the filtrate. You want to keep all that stuff. Glucose, since it's very small, can still get filtered and can become part of the filtrate. But then remember that through selective reabsorption that happens in the proximal and distal convoluted tubules, that glucose that it's found in the filtrate is reabsorbed, right? So then that means that your urine, right, the urine that gets released should only contain urea and water mostly, right? And the amount of water, of course, and the amount of urea is regulated via osmoregulation in the loop of Henle and the collecting duct, okay? So when you find certain materials in the urine that shouldn't be there, right, that is an indicator of something happening, right, or something being wrong. So let's look at these materials. So if a doctor finds a high level of glucose in your urine, this indicates diabetes. And this is because you have so much glucose in your blood, a higher proportion amount of glucose in your blood, that this glucose here does not get completely reabsorbed in the proximal and distal convoluted tubules. So you have a form of incomplete reabsorption. Sometimes you can find high quantities of protein in urine, and this can mean a couple things. For example, a condition known as Phenylketonuria Pku. And this means that you cannot break down a particular amino acid called phenylalanine. Most kids as babies, when they're born in hospitals here in the United States, they're tested for PKU, but it's not a regular test in other countries. Also, there is a protein called albumin, and if this protein is found in high concentrations in your urine, then that means that something is happening here in the ultrafiltration process that is not filtering these proteins adequately. So if you look, I'm going to quickly move here to this chart here, which I thought it was interesting. If you look at this stages of chronic kidney disease, notice that there's different stages that lead to a kidney being damaged with normal kidney function, with kidney failure. So notice that the glomerular filtrate rate or the GFR rate varies, right, according to this rate. So if you have a GFR rate that's less than 15, that means that less than 15% of your kidney is working properly, okay? And if you look at this chart right here, this is the albuminuria category. So this is the amount of albumin or protein in your urine. So someone who has kidney failure has a severely advanced form of albuminuria, which means that they have a lot of albumin or protein in their blood, higher than 300 mgs per gram. So going back to this chart, right, if you find protein in your urine, that's a sign that something is going wrong. Now, it could also be a hormonal condition, right? You might find a hormone in your urine, and that just might mean that you're pregnant. All right, if you find blood in your urine, it's always a little scary to find the presence of blood in the urine, and this can indicate a variety of diseases. It could indicate an infection. It could indicate a form of cancer. I went and I came up with, I looked up a list here of many different things that could indicate hematuria, which is blood in the urine. So it could be a simple urinary tract infection or bladder infection. It could be a kidney infection. It could also be kidney stones or stones in the bladder. And that forms for the calcification of minerals. And it forms these little stones that are very hard to get out, right? And then when they do come out, it causes a little bit of pain, or significant pain, I must say. In men, it could be an enlarged prostate, and so that's an underlying cause here of having blood in the urine. But it can also be some form of kidney disease or cancer, like bladder, kidney, or prostate cancer. So it's always a good idea to get yourself to a doctor and checked out if there's any blood in your urine. Now, in your urine, you can also find many drugs or toxins that pass from the body into the urine, and they can be detected. So we know that performance-enhancing drugs can be detected in the urine, and that's why athletes, when they compete, they have their urine analyzed. So here's the kidney disease spectrum, or the glomerular filtration rate, or the GFR. Notice that less than 15 means kidney failure. Anywhere from 15 to 55 means there's kidney disease. Normal means higher than 55. So you want your glomerulus within your Bowman's capsule to be filtering your blood appropriately. You want a higher GFR rate. All right, so what happens if a person's undergoing kidney failure? Well, the person has options. One of them is hemodialysis. Another one is a kidney transplant. So what is hemodialysis? So you might have seen some of these centers in the area where they do dialysis of kidneys. And that means that you're going to use a machine. You're going to use an external apparatus to filter your blood and remove these nitrogenous metabolic wastes. So what happens is your blood is removed from your artery, right? And it is pumped into this dialyzer machine. And this machine has two functions. So it takes it's made up of these different porous membranes that are semi-permeable. So it's going to filter your blood, right? And then it's going to take the bad stuff from your blood, all the wastes, and is going to put them into a container of some sort, right? But then it's also going to take up a fresh dialysate, which is a fresh fluid, right, that is going to maintain the proper concentration here for dialysis to actually happen. So then your blood gets filtered, bad stuff come out, right, and then your clean blood is returned back into your body. So this is, just a simple overview of how it works. So people who need kidney dialysis treatments, they go about 3 times a week, and the treatment lasts about 4 hours. So it is time consuming. These treatments can be effective for years, as a person might be perhaps waiting for a kidney transplant. The kidney transplant, it's a long-term solution for kidney failure. Once the kidney reaches a level where it no longer works, it just needs to be removed. So I'm going to actually go here to this slide because it has a little bit more detailed information. And this slide here shows you the treatment of a kidney failure via a transplant, right? So, of course, you need to find a donor first. And this can be someone who recently died, although it's recommended because of the viability of the kidney and what data has shown that it's better to get a living donor because just because of what data has shown, right, that there's a better success rate from a kidney of a living person. There's also been success rates from kidney transplants from someone who has recently died. But you can have a person give up one of their kidneys as long as it's compatible, right? So the donor and the recipient need to be a close match in blood, but also in tissue compatibility to avoid rejection. So the way that a kidney transplant is done, as you see here, the new kidney is grafted. So the old kidneys that are not working properly are left in place. Nothing is done with the old kidneys, but the new transplanted kidney is grafted in the lower abdomen. And then remember that this kidney has a renal artery and a renal vein and a ureter. So then they take those structures and then they connect them to your blood vessels, to the recipient's blood vessels, and to the recipient's bladder. So here you see the kidneys, or the transplanted kidneys, renal artery, the transplanted kidneys renal vein, and the transplanted kidneys ureter, right, all connected to the urinary bladder. And remember that to have one healthy kidney is sufficient for proper kidney functioning and blood filtering. So after a kidney transplant, of course, things need to be monitored to make sure that the kidney works properly, to make sure that your body and your immune system is not rejecting that kidney. But kidney transplants have been very successful in the past. So let's see here. That is it for 11.3 kidney disease. And that is it actually for topic 11.3.